Hello, everybody. Today we are here with a very, very special guest. I am thrilled to welcome a remarkable guest to our live show. My friend and a mentor, Dr. Patel, a seasoned, compassionate physician who brings a truly integrative perspective to healing. Skillfully blended allopathic care with the ancient wisdom of Ayurveda. This unique combination has led to impressive transformations in his patients. Dr. Patel will share valuable insights from both modern science and traditional healing systems. He's unpacked the hormonal, metabolic, and emotional roots of poor sleep and offer practical, sustainable strategies for getting the rest your body truly needs. Join us as we explore why sleep is not just rest, but medicine, especially for women navigating stress, perimenopause, and hormonal changes. Welcome, Dr. Patel.
Thank you. Thank you for the nice introduction. Thank you, Rajitha and uh, MedBricks for giving me this opportunity to talk on perimenopausal women and especially sleep issues. Thank you for my kind introduction. But yes, actually, my patients has taught me to learn all these things because someone has told me, my teachers, my mentors, always listen to your patients. So my patient used to tell me, sir, I don't want to take any sleeping pills, please tell me something else apart from the medicines. So I had done many research, gone through the ancient Ayurveda books. Some We have a team of Ayurveda doctors also. So after doing some research and treating so many patients, gradually over a period of time, yes, now we got a mastery to treat insomnia patients without medicines also now.
Wow, that is a wonderful concept of listening to your patients because going through my journey, I have faced where I went from physician to physician for myself. And that is a concept that does not exist, at least the ones that I have been to. My physicians did not want to hear what I had to say. They just, put it out, whatever they knew, and say, okay, this is how it is. And if that doesn't work, if everything fails, then okay, depression. Give you some more medicine for that. So thank you for listening to your patients and understanding their situation and tailoring your treatment according to their needs.
Actually, all these
And
things happen only when you have written the goal of treating or goal of curing or healing almost near 100%. We are not gods, but at least we can try to heal most of the patients. Then only you can read, you can do hard work, you can bring out, you can dig out many things like this and give benefits to the patients. But obviously, actually, you should not blame any pathy, you should respect each pathies. Only then you can going to understand that what are the pros and cons of each pathy. Actually, allopathy has a best part of emergency care, and alternative pathies, especially like Ayurveda, has a part of healing. Just for today's topic, like sleep issue, obviously, I know with your home remedies and all these things, you're not going to get sleep improved within few days. It will take months. So what we does, we start with a few medicines initially, means your sleep gets improved, then we start with the cognitive behavioral therapy. So the root cause gets improved. And then gradually with home remedies and the CBT, we start tapering the medicines. So we
mm,
have to respect the pathies. other pathies also. Then and then only we can give benefits to the patients. Otherwise, if you blame someone or some pathies, then we cannot.
Yeah, that's wonderful to hear how you are integrating that. So talking about, I talk to many of my female clients, and every time I talk to them, especially during the stages of perimenopause, menopause, they keep saying, I have such a hard time falling asleep. I can't fall asleep. Or let's say, even if I do fall asleep, then I wake up in the middle of the night or wake up early in the morning and I can't go back to sleep. So they're like, what can I do? I cannot go back to sleep. I am struggling with sleep and I wake up in the morning. I don't have much energy. As we see, the surveys from National Sleep Foundation has shown that up to 67% of women reported having trouble falling asleep. Can you please share why do women struggle more than men to get a good night's sleep?
Actually, two things are different. If we can talk about the women's, and second thing is the perimenopause. Actually, if we go with the ancient Ayurveda science, females have their two prakrutis are there in body. One is the mind and one is the physical body. With mind's prakruti, females has a rajasic. Rajasic means king-like attitude.
Mm,
Don't take it otherwise, but if you notice, they try to dominate at the home and offices also. And second thing is कि Vat Prakriti dominant. Vat में females are more talkative. Actually, just I am simplifying the things to understand. Uh, because of these things, because of Rajasic attitude and the Vat prominent, these two things. And second, as per the modern science, what modern science says, because of estrogen is high, that's why females have emotional quotient is higher than the male. So what these things does with the female body, uh, small incidents in a life, maybe with some relations, maybe with a job career, with children, there are a number of things. uh, when some small incidents happens in the life, that took it like a bigger problem compared to the main. And once these mental problems means thought process starts increasing, what they does, they start thinking on that incident, because they are not getting the solution of that problem. So overthinking starts. Once overthinking starts, more hormonal imbalances are going to happen because of the superficial sleep. During sleep, so thinking process continues. And because of these things, because of higher emotional quotients, rajasic prakriti and the vat dominant things, and higher emotional quotient, females get more sleep issues compared
mm,
to the males. Actually, why I'm comparing this with the incidences, because whenever you see any insomnia patients, most of, not for the females, but most of the patients, if you go to the root cause, there are somewhere problems in their life, and because of that problems, they start overthinking because they are not getting the solutions of that problem. So these are the main issues. That's why they become overthinkers, and that overthinking leads to the insomnia. Yes, hormonal imbalance plays the roles, but it is one contributing factor. But most of the time, this is the main cause because of which females get more insomnia issues or the sleep issues.
wow. So from what you have just said, women think a lot, get very emotional with every little thing, and then blow it up into bigger. The issue could be small, but they make it bigger. And since that issue is not solved, they keep thinking. The thinking never stops. Even during sleep, it never stops. It's going on continuously in the background. So we are not getting that restful sleep because we never solve that, whatever the issue was, either one incident or going back to childhood, whatever the different things are. So that is constantly being played in our head, and we're not able to shut it off during sleep time and not getting proper sleep.
Yes.
Wow, that that is really eye-opening to understand what can we do to solve that issue, whatever that root cause is, solving that root cause, understanding what is going on beneath the surface, pulling that hood out and seeing what is going on and trying to solve that root cause, whatever that issue is, to calm the mind.
Actually, if we see the problem, whatever the problem anyone having in their life, there are two things. You have a solution for this, or you don't have a solution for this. If you have a solution for this, that is okay. But if you don't have any solution, then what you are going to do for that? So then I tell my patients to keep that problems at the legs of your God and just tell him to get solved. Till that you remain calm. I know no one has saw the God, but yes, that thinking and that faith gives you the mental strength to remain calm in the difficult scenarios. From this, I start my counseling to the patients to solve that problem, because it is not easy to give solutions to everyone. Yes, sometimes we can give solutions, but sometimes you cannot give solutions. Just yesterday, I have one patient who is having the losses in his business, and he don't have any backup plan. So what can you do? You cannot do anything. Just I told him that you just start one some job with any whatever the skills you have. You just try to stabilize your family. You just try your foods and your basic requirements gets ensured, and then gradually and slowly you build your empire again. Yes, it will take a decade or two, but just remain calm and again build your empire. But yes,
Wow.
you're not going to give him back his empire again.
Yeah. Yeah. So what you have just said is, have faith and surrender. Surrender, to that higher power, the God. If you believe in God, God. If not, it's whatever the higher power is. Surrender and have that faith that it is going to resolve, and surrender. And in your practice, I hear that you're not only treating patients, prescribing, you're also, understanding their lifestyle, what is going on with this patient, how you kind of advise, all right, the business did not work out, but in the meantime, go get a job, get that sustainable going. And how many that I can't remember when the last time I talked to a physician who really, it was years ago, where I would go into a doctor's office, they pull up a chair next to me, sit down and ask, hey, what's going on? And talk about what else is going on in life other than the problem I went to them for. Nowadays, it's not like that. We barely get eye contact with our physician because they're constantly busy typing away, taking notes. There is no eye contact, no, there's no trust. I really applaud you for what you are doing for your patients. That trust is a huge thing, that relationship building and the trust that you have with your patients. Thank you for that.
Yes, that is a must thing. Actually, as the doctor under whom I have got trained, he told me that within 15 minutes of consultation, 5 minutes you have to take the history with eye to eye contact first thing. Second 5 minutes for the examination, then 2.5 minutes or 2.5 minutes for a prescription writing, and last 2.5 minutes for the rapport building with the patients. Yes, obviously, if we go to the root cause, root cause. When you want to heal someone, you have to identify the lifestyle, sleep, diet, mind, and the exercise. Until and unless you try to find out the faults in these four pillars of the life, you cannot heal anyone. So, in that last 2.5 minutes, we ask them what else is going on in your life and all the other health lifestyle pillars. And yes, in today's date also, I knows my most of the patients by their name, their children's also now. Its second generation is also coming to me. And yes, in India, we love that family doctors concept with the specialty care also. But that touch should be there. I believe in mandir and in hospital, patients and the followers, they must have 100% faith in the doctor. If someone is keeping 100% faith in you, then yes, you have to give 100% of yours to them. Only then we can give better results.
Wow. Yeah, that is a whole person approach. Talking about that, a lot of them say that as you're getting old, they are under the belief, okay, I'm getting old, I don't need much sleep. That's the reason I'm not able to sleep, because it's the old age. That's why I'm not able to sleep. Is that true? Just because we are getting old, is 2, 3 hours of sleep enough? Or being drained and exhausted all day? Is that good enough? Is that because of the old age means we can't do anything?
No, actually, if we go into the any guideline of sleep, especially CDC, NIH, and the American Sleep Study Guidelines, all have mentioned that even anyone who is more than 65 years old, they need minimum 7 to 9 years, 9 hours sleeps. That is compulsory. Yes, it is a excuse only that I have old age. Because of old age I couldn't get sleep, but I don't have any problems. Uh, we also encounter such patients daily, but I just request them to have a sleeping pill once, at least once. You just try that pill, and you just give me a follow up how you feel the next day. Then they realizes कि yes, I was feeling very low with my routine 4 hours and 5 hours sleep. But yes, after taking pills or sleep improvement, they enjoy the life and they get a proper peaceful mind after that sleep. But yes, there is no guideline in world says that older peoples require less sleep. They also require minimum 7 hours sleep, not below that. That is compulsory.
Okay, so the thing you brought up about taking sleeping pill, if they're not able to sleep, just to compare where they were before to afterwards. So by taking sleeping pill, do we get that restorative sleep that we need through the night? Um, when you wake up in the morning, feel rejuvenated, the quality of sleeping pill, um, does that give that?
Yes, pardon me. I not understood. Wait.
So does the sleeping pill, by taking the sleeping pill, do we get that deep restorative sleep?
Okay. Actually speaking, frankly speaking, you don't get that natural sleep with any sleeping pill. You get deep sleep, but you don't get a proper sleep cycles. Only one pill is there. If you know that melatonin, it is just recently introduced by the medical science. Actually, our sleep cycle is regulated by the melatonin hormone, and yes, now synthesized chemical melatonin in tablet form is available, and that is the only pill which gives you a proper sleep cycles in a deep state, and it recovers your sleep properly. But otherwise, whichever the pills available in market initially, benzodiazepine, benzodiazepines, and some other pills, antihistaminics, and all these things. Yes, you get sleep, but you don't get that proper sleep cycles regularized. Yes, you can get a deep sleep, but not proper reconstructive or rejuvenating sleep. So ideally, sleep pills should be avoided. They are aid to sleep. They are not like a diabetes pill that you should take for lifetime. They help to regularize your sleep initially.
Okay, so from what I understand, you're saying you can take when you need it, you're not able to get sleep, start with melatonin, but cannot depend on it every day. That's just an aid to get you over that hump. And then, then you need to slowly taper that off.
Yes, what I does in my practice now after melatonin is available in the market, melatonin is not that strong molecule, but yes, within 15 days to means 2 to 3 weeks minimum, patient gets a proper sleep. After that, once patient starts proper sleeping, what we do, so we start cognitive behavioral therapy, means that healing part, what the problem he is having. We try to stop his overthinking. For second thing, we start with some alternative pathy remedies like one Zyphod powder is there. Second, Navratna oil, head massage. Third one is Shirodhara. One Ayurvedic procedure is there with some medicines are trickled down your head. These all procedures improve your sleep. So we start with medicine, and once patient get a proper sleep, and once he feels perfectly all right, at least after 15 days, means 2 weeks to 3 weeks, we start with the alternative remedies. And yes, after an overlap of 1 or 2 weeks, then we start tapering the drugs. Yes, in most of the patients, my clinical experience is more than 90% patients, if they can follow our guideline completely, they stops overthinking, they get proper sleep. Most of them, in more than 90% patient, they can stop these medicines. At least this phase, complete phase, requires 2 to 3 months period, because even when we stop that sleeping pills now, we stop very gradually. If we are taking 5 mg melatonin, then we reduce to 3 mg, then 3 mg that melatonin pill will be taken by alternate day in 1 week, then every 2 days, every 3 days, every 4 days, and gradually tapering. Once patient takes weekly one tablet, then we stop it. It requires usually 2 to 3 months period, but yes, more than 90% patient gets proper sleep, and they can maintain their sleep properly without medicines also. But yes, along with these remedies, sleep hygiene is also a one topic which we counsel to them at the first consultations only. What is there in the sleep hygiene? What in sleep hygiene, your bed sheet should be clean, your pillow should be comfortable, your bed sheet should be your bed should be comfortable. Then in the room in which you are sleeping, that should be a quiet room. There should not be any noise. Even AC noise can disturb your sleep. Light should be minimum possible, or if you can sleep in a darkest room, that is the best for melatonin production. And screen time should be stopped, means your mobile, TVs, and all screens should be stopped minimum 2 hours before your sleep. All for if we work on all these things, then only patients recover their sleep.
Hmm. Okay. So in the beginning, you said, you start with the medicine, you gradually taper it off as you're doing cognitive therapy. So during this time, you're trying to talk to the patient, understand what are the underlying issues going on. Is that what you're doing with the cognitive therapy?
Yes, actually, I don't counsel any patients on the first consultation because his mind is not calm. I wait for a few weeks. Once he gets a proper sleep for at least 1 week or 2 weeks, When he feels he is perfectly all right, then I ask the patient for a counseling session. Then I try to understand the exact what was the problem in his life, his or her life, which led to insomnia, or what are the lifestyle issues there in their life, because sometimes this also happens. There are few medicines which are causing insomnia. So yes, all these problems we have to identify, and yes, then I prepare a plan for them, like cognitive behavioral therapy, some plans for coming out of that problems, then meditations, especially a yoga nidra procedure. All these plans we made. Yes, it is not that like that in every patient we give everything. In Ayurveda also we have a practitioners, they decide the prakriti of the patients. As per prakriti they decides in which patients ashwagandha should be used, in which patients brahmi should be used, in which patients manas mitravati should be used. In few patients we use only shirodhara procedure. uh, in most of the patient I use navratna oil for the just massage. It also improves your initial sleep lag time, improves your sleep lag time. Yes, most of the in most of the patient these things we do routinely for the counseling and the healing part.
So can you expand on that just a little bit on the Ayurvedic healing pattern that you do, like the Navratan oil, ashwagandha um, type of things? Is it different things for different patients depending on what's going on with them? How does that work?
No, actually, which thing will work in best in which patient, that will be decided from their prakriti and the imbalances of the doshas. Actually, Ayurvedic principle works on the Vat, Pitta, and the Kapha. Most of the time, sleep disturbances happens with the all three dosha imbalances, but the most common is Vat imbalance. So, in Vat imbalance, Shirodhara works best and Manas Mitravati works best. Uh, Actually, frankly speaking, I am not Ayurvedic specialist, but we have a team. We have MD doctors in Pitta Prakruti.
What
Medicine.
imbalance is again what?
Vat imbalance means it is a dosh. Means Vat can be correlated with the autonomic nervous system of your body.
Hmm.
Uh, Actually, it is not the perfect word, only autonomic nervous system. But what research I have done, it is a most equivalent thing in modern science. What they talk about the Vat imbalance, uh, what we have discussed earlier, increased thought process. This is the most common cause of insomnia. So, whenever thinking process increases, your sympathetic activity remains very high. So that sympathetic and parasympathetic imbalances that happens in the Vat Prakruti, that the people call it as a Vat imbalance. So in same patient, if you start meditating that patient, or you teach them mindful techniques, or you give them some pills for sleeping pills, these all things decreases vata in your body. And in modern science, same thing what happens, parasympathetic activity increases and sympathetic calms down. So these
So
are doshas.
okay. So what you have just said, like about that again, the thinking patient, right? Somebody that has a lot of thinking going on. When they are doing meditation, are they able to get themselves to that calm level? Yeah, they cannot stop thinking, but is that dialing down? Does that help?
No, actually, meditation for an insomnia patient, it is the hardest things to do. Once they start, when they close their eyes, now their thinking increases. So what I does in my practice, initially I start with the Yog Nidra procedure. What is basically Yog Nidra? Yog Nidra procedure is should be done before sleeping. Uh, just I will give you example during sleep. we give a command that make your feet tight, more tight, and just relax. Like that, what it does, whole body muscles. Initially, we have to give command to tighten that muscles, and then we have to relax. So, in sleep, what is the basic sleep physiology? You will get deep sleep when your all muscles are relaxed. So, in Yog Nidra procedure, your wavering mind, which were wavering with some thought process, it aligns with your body, with that body mind alignment, that command giving procedure, and with that your muscles relaxes. So, it improves your sleep lag time.
Hmm.
So, this is one Yog Nidra procedure. I starts with the Yog Nidra. Yog Nidra improves sleep initially. Second thing, rather than directly starting meditation with the closed eyes, Trikut procedure is there, in which I tell my patients to just concentrate on a one point. You can draw by yourself also. You can just focus on one light, one fan, or any one single object. Continuously, you just focus on that point for at least an half an hour.
Half an hour.
Yeah, it is very difficult for them. Even they cannot focus initially on single point with open eyes. So we motivate them, we tell them to initially focus on the breathing, take deep breaths. So after doing these things, they improve their concentration time on a single point. And after that, I told my yoga teacher, my yoga and meditation teacher is common, so that meditation teacher start meditating that patients. Before that, it is very difficult that if you tell them to meditate, they will do anything. It will not benefit them.
So you take them on a step by step, slow process, one after another, gradually to
Yes.
get to that parasympathetic state so they can relax their mind and body to fall into that deep sleep pattern.
Yes, actually, if we want to learn to drive a car at 120 speed, we have to learn to drive a car at 20 speed, then 40, then 60, then 18, then 120. Not directly, we cannot meditate. So, if a normal person can't meditate initially directly, then how can an imbalanced mind person can do? So, actually, nowhere is mentioned in scripts about these things, but over a period of time, I developed this technique to gradually and slowly tell them, motivate them, assist them, and then they can gradually move on to the proper meditation.
And we have another set of thought process that, weekdays everybody is busy running around, and they stay up late and they say, okay, we don't need much sleep. 5 hours, 6 hours, that's good enough, whatever they can get. And then I can catch up on a weekend, sleep all day on a weekend and catch up all that sleep. Does that work?
No, actually, every guideline, allopathic guideline and the Ayurvedic guideline, they have clearly mentioned you have to take sleep daily. It is not the thing like that you are finishing your homework in the weekends that you have to do daily only. Why daily? Because body damages daily during your routine works and exercises and everything, whatever the things are, even digestion damages your intestinal borders and all these things. So sleep is the only part of your life when your body repairs. So you are delaying your repair by doing all these things. What you are doing, you are taking 4 to 5 hours sleeps. In that 4 to 5 hours sleep, you will not get a proper deep sleep, REM sleep, when your body repairs. So this is also one of the reason for developing cancer in the long term.
Mm.
There are a number of things happens with the sleep disturbances, but Just I'm giving the example because in today's scenario, cancer is so much increased. This is also one reason. So you have to take sleep. Frankly speaking, uh, in our doctor's profession in India, we work for 24/7 for years. We also disturb our sleep. But initially, I was also in the wrong mindset that after doing a deep meditation, you can compromise sleep. But no, it also doesn't work. I have also got a breakdown in my life with abdominal migraine just 3 years back. I have healed it completely within 2 years without any medicines, and since last 1 year, I'm absolutely fine. But yes, after that, I have understood one thing: you can disturb anything, but don't disturb your sleep.
Wow, sleep is very important. So, can you share with our audience some simple things that they can start off with from tonight? What can they do to get a better quality of sleep?
Okay. Uh, First thing, if you don't, if you're not getting a proper sleep, first you identify what problems are going on in your life. First, second thing, once you identify that problems, then just think on that if you can think. But if you are not able, mentally sound, to decide on that, you just take a help of your some of your friend who is very much intelligent on that topic. You just discuss. Example, if you are having a loss in a business, just talk with some businessman friend who is successful in his business. If you have some relation issues, you can talk with your seniors like your mother, parents, or some older age person. Like that, you just have a take a help of some expertise to solve that problem. First thing is this. Second thing, once you identify the problem, you try to derive solutions for that. And if you can't derive any solutions for that, you just forget it. You just forget it. If you have, if you can get 2 times or 3 times meal properly in a day, and if you have a proper place to sleep in the night, you are at least one of the happiest person on the earth. That should be satisfaction with you. Don't try to indulge in so much other things that which car your neighbor is having and how much he is successful. Just mind your business only. Try to get solutions. If you don't get solutions, just wait for the god's call. He will solve your problems, but till that time, keep calm. Second thing, after once you solve these problems, sleep hygiene, what I have earlier talked. Dark room, noise proof room, a proper good smelling bed sheets, comfortable bed, comfortable pillow, all the sleep hygiene measures you improve. You start using Yog Nidra even if you have a good sleep. If
Hmm.
you follow Yog Nidra procedure, even if you have a good sleep, it will maintain your sleep till long time. And yes, you can use if you have a insomnia issues. What Yog Nidra does, Yog Nidra stops your brain activity, which is the first step to get your sleep properly. With that, start doing workout. At least minimum whatever you can do. At least do a 15 minutes to 30 minutes small, moderate, or whatever the workout you can do. Because once you get tired with the exercises, your sleep improves. And along with that, you can start doing massage before sleep. Yes, these are the basic precautions which you can start from today only, and just wait for anything to work. It is not like that you start all these things today and it will work within a day or two. I will tell you, within 2 to 3 weeks all these things will work. But just you compare your sleep day by day. Compared to yesterday, your sleep is better. So just wait, your sleep will improve. But 2 to 3 weeks time it will take. These things you can do daily.
All right. Thank you so much for those wonderful tips. That massage at the end of the day, really massaging that scalp area to relax, and before you hit the bed, lay your head on the pillow, and doing some yoga nidra. Um, these are awesome practices that they can start off with all the others, keeping the room dark, nice and cool, bed comfortable, and exercise. Exercise, just a quick question on that. Do you exercise, does that need to be done before sleep or earlier part of the day?
Actually, what data says, ideal exercise is early morning, ideally, for overall health benefits, for obesity, diabetes, insulin resistance, anything. But for especially those who are diabetics, those patients postprandial sugars are remaining slightly higher, and third thing, for sleeping, postprandial workouts improve your sleep, but not the strenuous exercise. Actually, ancient science says you just walk for 100 steps or 200 steps, just a gentle exercise, but not heavy exercise post meal. You just go for a small walk and then you take sleep. Uh, but second thing, you can do. There is one procedure who is developed by some South Indian. Actually, I don't remember the name of that procedure. It is also most similar to Yog Nidra. What
Mhm.
it teaches, like Zumba like dance or anything like that, you just do pre-prandial. Before your dinner, you just do a slightly heavier, moderate exercise. You just take your dinner, walk for a 5 or 10 minutes, your sleep improves. These are two things you can do after meals, a small gentle exercise. Before meals, you can do slightly a moderate level exercise like a dance, or maybe Zumba dance like activities that will improve your sleep. And these are all data proven things.
Wow. So these are structured things, data proven things that where we need to invest the time in ourselves to incorporate these things into our daily life so that we can get a better quality of sleep to have better health.
Yeah. Actually, you have to invest 1 hour in 1 hour for your health. Then only 23 hours will be yours. Actually, I also believes in the God's call. No one knows who is going to leave the earth when, but yes, uh, you can remain healthier till the date you are present on the earth. I will give you two examples. uh, One is you met with an accident while running your car at 120 speed. That thing you have attracted, it was not your destiny. And second thing, you were driving your car at a 40 or 60 speed and you met with accident, it was your destiny. So you do exercise, you invest in your health, you meet experts, then only you can live healthier till your end of life. Otherwise, we saw a lot of patients who becomes bedridden at the end of life. That is the worst part of life. In European countries, US also, these things are increasing, and India also it is increasing.
Right. So to have a nice quality life until our time is up on this earth, we need to focus on ourselves, invest that time and energy um, on ourselves to take care of ourselves to be healthy, and then the rest is up to the Lord.
Yeah.
All right. Thank you very much for your time, Dr. Patel, and for these wonderful tips that you have shared here with us. Um, we greatly, greatly appreciate you. Thank you.
Thank you so much. Thank you.